How is uveitis categorized by location and onset? Imagine your eye as a busy city with different neighborhoods, each capable of experiencing inflammation. Uveitis is a condition where parts of the eye become inflamed, and doctors classify it based on where the inflammation happens and how it develops over time. This helps them figure out the best way to treat it and understand what might be causing it. First, the location of the inflammation is key. The eye has a middle layer called the uveal tract, which includes the iris, ciliary body, and choroid. When inflammation is limited to the front part of the eye, involving the iris and ciliary body, it's called anterior uveitis. This is the most common type and often causes redness, pain, and light sensitivity. If the inflammation mainly affects the vitreous, the gel-like substance inside the eye and the peripheral retina, it's called intermediate uveitis. Sometimes this is referred to as pars planitis, especially when snowbank or snowball formations are seen during eye exams. When the back part of the eye, including the retina and choroid, is inflamed, it's called posterior uveitis. This can cause blurred vision and floaters. If inflammation involves all these parts at once, it's called panuveitis, affecting the entire uveal tract without a specific focus. It's like a citywide event impacting all neighborhoods simultaneously. Beyond location, uveitis is also categorized by how it starts and how long it lasts. If the inflammation appears suddenly and lasts less than 3 months, it's called acute uveitis. If it persists longer than 3 months, it's considered chronic uveitis, which might need ongoing treatment. Sometimes, the inflammation comes and goes in episodes, separated by periods of no symptoms. This is known as recurrent uveitis. Understanding whether uveitis is acute, chronic, or recurrent helps doctors decide on the best treatment plan and monitor for potential complications like glaucoma or macular edema. Uveitis can also be classified based on its cause. It might be due to infections like viruses or bacteria, or it could be autoimmune, where the body's immune system mistakenly attacks its own eye tissues. Sometimes, the inflammation is granulomatous, meaning it forms large, macrophage-rich lesions, or non-granulomatous, which involves smaller inflammatory cells. This detailed classification helps in pinpointing the cause and tailoring treatment accordingly. In summary, uveitis is primarily categorized by where the inflammation occurs in the eye, whether it's in the front, middle, back, or all parts, and by how quickly it starts and how long it lasts. This system of classification is vital for accurate diagnosis, effective treatment, and better understanding of the disease. If you experience symptoms like eye redness, pain, or vision changes, it's important to see an eye care professional promptly. They can evaluate the specific type of uveitis you might have and recommend the most appropriate care. Always remember, each person's situation is unique, so personalized medical advice is essential.